हेलो गुड मॉर्निंग, मैं से डॉक्टर आर्यन और आज हम डिस्कस करेंगे मेडिसिन के कार्डियोलॉजी सेक्शन के सम इम्पॉर्टेंट MCQ। अ 42-year-old male presents to the cardiology clinic with complaint of intermittent palpitation and lightheadedness. His electrocardiogram reveals a pattern consistent with Lorn-Gannon-Levine syndrome. Which of the following ECG finding is not a characteristic of this condition? PR interval is short, QRS is normal, PG interval is short, and PG interval is long. Here the question says the Lorn-Gannon-Levine syndrome. In Lorn-Gannon-Levine syndrome is a characteristic ECG finding include a short PR interval, normal QRS duration, and duration at a sort of PJ interval. Here the question says the not characteristics is a PJ interval is long. This is the answer, because the therefore point is PG interval is long is not a typical ECG finding in Lorn-Gannon-Levine syndrome. And what is a Lorn-Gannon-Levine syndrome? It's a rare condition disorder characterized by a short PR interval on ECG, normal QRS, duration and episode of supraventricular tachycardia. It involves an accessory pathway connecting the atria and ventricles bypassing the AV node, leading to the rapid transmission of impulses and shortness PR interval. Here the treatment may involve medication to control symptoms or catheter ablation of the accessory pathway. Next question. A 65-year-old male present to the clinic for a routine checkup. During the examination, his resting heart rate is noted to be 70 beats per minute and his blood pressure is within normal limits. The physician notices that the duration between the P wave and the QRS complex on the electrocardiogram is consistently prolonged, measuring at 0.24 seconds. Which of the following is the best recommendation for this patient? No specific treatment, deoxynitrone and labetalol. Here the question says the consistently prolonged, measuring at 0.24 seconds. The answer is no specific treatment, because the first degree heart block is characterized by prolongation of the PR interval on the ECG indication, delayed conduction through the atrioventricular node. In most cases of first degree heart block, especially if asymptomatic, no specific treatment is required. It is typically considered a benign condition that does not a necessitates intervention. Next question. A 60-year-old male present to the emergency department with complaints of palpitation and shortness of breath. An electrocardiogram is performed revealing an irregular rhythm. Which of the following ECG wave is absent in the patient? P wave, T wave, Q wave and U wave. Here the question says the electrocardiogram is irregularly performed in irregular rhythm. In atrial fibrillation, the atria exhibit a electrical activity resulting in the absence of organized atrial depolarization. What are the causes? The causes absent of P wave. Here the answer is the absent of P wave. And in T wave represent the ventricular repolarization, and the Q wave represent the septal activation, and U wave follow the T wave and represent the repolarization of the where Purkinje fibers are papillary muscles. Next question. A 60-year-old male patient present to the clinic with complaint of occasional dizziness and lightheadedness. An electrocardiogram reveals a pattern consistent with morbid type of wing phenomenon. Which of the following statements best describe this condition? Accelerate AV nodal conduction, progressive decrease in PR interval with each beat and a missed beat. Prolonged increases in PR interval with each beat and a missed beat. Just note a point. Decrease, here the increase. The answer is prolonged increases in PR interval with each beat and a mixed beat, because the morbid type 1 is wind bank phenomenon is in the intranodal conduction defect that leads to the progressive increase in the PR interval with each beat until a beat is dropped, a missed beat followed by a reset of the conduction sequences. Next question. A 65-year-old male patient with a history of hypertension and previous myocardial infarction presents to the emergency department with complaints of dizziness and a near fainting episode. A electrocardiogram is performed, revealing a pattern consistent with morbid type 1. Which of the following is not seen in the condition? Here is the morbid type 2. Type 2. Morbid type 2. Not 1. Infranodal block. PR interval is normal before a missed beat. PR interval is increased before a missed beat. PR interval before and after a missed beats are equal. Here the answer is the C. PR interval is increased before a missed beat because typically there is a sudden skipped beat without a change in the PR interval is the Morbius type 2 heart block. This regional intermittent failure of conduction from the atria to the ventricles. Next question. A 60-year-old male patient present to the emergency department with palpitation and shortness of breath. His ECG reveals atrial flutter with a rapid ventricular response. The patient's blood pressure is stable and he is hemodynamically well. Which of the following interventions would be the most appropriate as first-line treatment of rate control of this patient? Intravenous esmolol, chemical cardioversion with intravenous amiodarone, electrical cardioversion with biphasic DC shock, anticoagulation with unfractionated heparin. Here the answer is the intravenous esmolol because in the acute management of the what here the seen atrial flutter with a rapid ventricular response. The priority was the priority is the rate first to control the rate control to reduce symptoms and prevent hemodynamic compromise. Intravenous beta blocker like esmolol or calcium channel blocker like verapamil are commonly used for the rate control in the setting. Esmolol acts rapidly and can effectively control heart rate in patients with atrial flutter without compromising cardiac output. If we give the chemical cardioversion with intravenous amiodarone, while amiodarone may be used in chemical cardioversion in certain cases of the atrial fibrillation, it is not typically the first-line treatment for acute atrial flutter. If electrical cardioversion with biphasic DC shock, electrical cardioversion may be considered if the patient is hemodynamically stable, not unstable. If the patient is hemodynamically unstable or if rate control measure fail, but it is not usually in the initial treatment in stable patient with atrial flutter. If anticoagulation given with unfractionated heparin, then the anticoagulation is important in atrial flutter, especially before cardioversion to prevent a thromboembolic event, but it is not the first line treatment for acute management of atrial flutter with a rapid ventricular response. That's all. Thank you and keep revising.